This is Grace with Graceful Living. Today we have a special guest, Liz Miller. She is going to talk about how she deals with the pain from fibromyalgia.
Hi, my name's Liz Miller. I am a visual artist and a yoga instructor. I live in Honolulu, Hawaii. I discovered I had fibromyalgia in 2009. I started having a lot of pain and stiffness in my body that was abnormal, and it felt like hard to move, and I didn't know what was wrong with me, so I went to my massage therapist, who was also an anatomy teacher and taught massage. And he started to work on me, and he said he'd been working on me for a couple of years, and he said, "Liz, I think you should go to a doctor. Your muscles don't feel like your muscles. Normally your muscles are soft and they feel all dried out and brittle. Something is going on with your system." So I went to the doctor. I went over and over to the doctor to try to have tests done. First they thought I was crazy or a hypochondriac, and my friends and roommates thought I was a hypochondriac. It basically hurt to get up out of bed and even carry my head on my shoulders or walk down the street. Just incredible pain in my lower back, my neck, my shoulders throbbing in front of my collarbones, and hips as well. And also really tender knees and elbows. So they tested me for MS, they tested me for lupus, they tested me for various deficiencies, and they couldn't find any of those things wrong with me. So they said that, we think you have fibromyalgia and there's no explaining where it comes from, and you're going to have it for life. And they put me on nerve pain medication, Neurontin, and they said they, would like to eventually. I was kind of resistant to that. I tried, ibuprofen and other things. I was resistant to that because I was already doing a lot of yoga, and I'd already started teaching yoga. And they said they wanted to put me on Lyrica, which is a stronger medication used for fibromyalgia, and I looked up the side effects for that drug, and I thought it was unsatisfactory. The side effects included, increased suicide and an average weight gain of over 30 pounds. And another one of my symptoms that I had at this time, which people really thought was crazy, was that anytime I would eat, I would have intense burning pain, especially across my collarbones. And it would kind of radiate through this part of my body. And I would feel really tired and just lethargic, and I had really bad brain fog. And so I started eliminating foods from my diet, and people thought I was crazy. It also hurt very much to drink any alcohol. And certain foods, and I'll describe later, certain foods bothered me a lot more than others. So when I first had fibromyalgia, it hurt to exercise very much. Like, it was very intense burning, and I had a regular Ashtanga yoga practice, and it hurt very much to do chaturanga, and it took me a very long time to get into the poses, and everything joint in my body hurt. But I did find that after I did try to practice, I felt better. So when I first had fibromyalgia, I stopped going to regular classes, but I practiced at home. And I did a modified practice that was less dynamic. I would, drop onto my knees to do the push-ups, and I wouldn't do jump backs. And I would just go slowly into the postures, but I would do them. I would get the stretch. And I would keep breathing and moving, and try to stay in a warmer area because cold made me feel even stiffer. And slowly over time, my body got used to it. It was still years before I could actually do a chaturanga without pain. It took a while, but eventually that feeling went away. from regular practice, but I had to keep doing it at least 3 or 4 times a week. I stepped it back, but I still continued. Another activity that made me feel better was hard, but to get in the water and swim as long as the water isn't too cold. Especially ocean water seemed good because it's always moving and it forces you to move. So those 2 activities helped. I tried a lot of different things. I tried acupuncture with a few people in San Francisco at the time, and I didn't find it helped me personally. I know it helps some people, and later on down the road I did find an acupuncturist that was able to help me find relief. I think that was just a trial and error thing to find the right person. But I did try herbs. I tried a few different herbalists, and I eventually found someone in Australia actually who specialized in chronic conditions, and the herbs she put me on, I was on Chinese herbs for 2 years, and I was boiling them twice a day, every day, the strong ones, for about almost 2 years, and then I went on to the powdered herbs. Now I'm not on any herbs, but it was a part of my regimen, and after about 3 months on the pain medication given to me at Kaiser, I trickled off. It was very hard when I trickled off. The nerve pain was very intense, and I was on a very small dose. I was on about 1/3 of the dose that they wanted me to be on. They wanted to up my dose, but I didn't feel right mentally on it. I felt kind of brain dead, like a zombie, so I didn't want to continue. So it was very hard getting off the pain meds. It took about a month, even only after being on a small dose. I felt like my body was on fire. The other thing I did, I just started becoming aware of what foods aggravated my condition, and I noticed that this is a long list. Anything sweet, and I'm talking about including sugar. Of course, refined sugar was the worst, but including fruits, even carrots and beets, made me feel worse. Anything spicy or fried made me feel worse, which was hard for me because I really like spicy food. Anything very salty made me feel worse. Dairy products made me feel worse, and gluten made me feel worse. So I was basically left with healthy fats, avocado and oils and nuts. Certain kinds of proteins seemed to make me feel good, and grains seemed to be good. Basmati rice, quinoa, yams, and red potatoes seemed good, and all the green vegetables made me feel great, especially kale, seaweed, chard, and collard greens. So I started on a diet that was pretty much based on those foods only. So that was a big change. I also started taking supplements. These days massage does help because anytime I have a muscle adhesion, it's a lot more painful, I think, than for normal people. It seems to go into my nerves. At that point, it was so systemic that I don't know. The inflammation was so bad. It's kind of made me even feel a little bit worse because it would make me a little bit sore afterwards. Thai massage was a little better, where they stretch you. That seemed to help. That was a good one, a more gentle massage at that time. Now I go for the deep tissue, and I find actually going into the pain and releasing the adhesions actually helps relieve when I have minor symptom flare-ups these days.
So you practice yoga every day, and that helps you keep the fibromyalgia at bay, would you say?
Yes, and it's important that I practice some people like to practice in a heated room, and that's fine, like a infrared heated room. That's good for some, and I do that sometimes. I like to actually practice in a way that makes me heat my own body because I feel like it's more effective actually bringing the heat from the inside out. And also the concentration, and you're just using the willpower because there's always something, more than one thing that hurts in my body, but it helps to relieve my symptoms.
Thank you, Liz, for sharing your story and insight with us. Please stay tuned for the next video with Liz showing us some yoga for fibromyalgia. If you like this video, please give me a thumbs up and subscribe. Please go to graceandhawaii.com for more information.